Health Organization has said today, literally, do not panic. But how well prepared are countries around the world to combat this virus? We can talk now to global health expert at the University of Oxford, Dr. Peter Drobak. He helps developing countries draw up their plans for dealing with disease outbreaks. Good afternoon, good to see you.
Thank you for having me.
There's going to be a clear haves and have-nots when it comes to countries that are equipped to deal with outbreaks like COVID-19.
Absolutely, and I think what we're seeing in the UK is a tremendous response in terms of preparedness, and I think they're doing everything right. I think the real concern is that in countries with less well-resourced and less well-developed health systems, they're not in a position to contain an outbreak of new cases were it to come. We're seeing that a bit in Iran right now. One thing we need to keep in mind is that a threat to public health in the 21st century, a threat to public health anywhere is a threat to public health everywhere, and so the international community really has a responsibility to support countries in their own preparedness.
It's interesting. We talk about developed countries being more robust and well equipped to deal with outbreaks. What's happened in Italy then? There was some suggestion by a public health minister in Italy that the hospital where this originated, where the first case presented itself, wasn't ready, wasn't following the proper protocols.
Yeah, I don't have specifics on what happened at that hospital, and so I can't say.
But just in terms of somewhere like the UK, for example, we were just hearing from our science correspondent Thomas Moore saying the NHS is well prepared to deal with a flu outbreak. But we're in the kind of season where flu cases are on the up. Add COVID-19 into the mix. Can it really cope? We keep hearing how our NHS service is at breaking point as it is.
Yeah, you know, we're in a situation now where we're still in containment mode, but we've seen how quickly the disease spread in China. The good news, of course, in China is that the extraordinary containment measures there seem to have borne fruit, and we've seen a decrease in the number of new cases in a sustained way over several weeks now. So that really suggests that we can do this. And for several weeks now, the NHS has really been preparing for a worst-case scenario, which would involve a much larger number of cases in the UK, and preparing the health system accordingly.
SARS and MERS each killed fewer than 1,000 people globally. COVID-19 already reportedly killed more than twice that number. Do you feel that this new virus is more dangerous because it appears many people may develop no symptoms whatsoever, so it can travel further and faster?
Yeah, the mortality rate that we've seen thus far with COVID-19 is lower than that of SARS or MERS, about 2% of cases. And those are concentrated primarily in the elderly and those with other diseases. But what's different from SARS and MERS is that this appears to be much more transmissible. And so we're seeing a much more rapid spread of transmission, including those with minor or no symptoms. We're still learning a lot about this COVID-19, and the virus has only really been with us for about 8 weeks. Some of the earliest data coming out from more aggressive screening procedures of hundreds of thousands of people in China suggest that, well, yes, there is transmission possible in people who are infected with no symptoms. That does not appear to be a big driver of transmission. It's predominantly people who are having symptoms like fever and cough.
In terms of the advice that's being given out in various countries, the UK included, is to call 111 or whatever service is available, self-isolate, and if it's a particularly bad case, there's a quarantine put in place. How does this help the health system? Because governments don't want to find themselves in a situation where hundreds of people go marching to their local health facility, whether it be a GP surgery or a hospital, perhaps with COVID-19, perhaps not. Health systems could not cope with that, could they?
Well, you're right that we know, of course, this virus is easily transmitted by people who are in close contact, and that the most vulnerable are those who have underlying medical diseases. So we really want to avoid, whenever possible, someone who may have the coronavirus infection to be in a crowded waiting room with other ill people. And so it's really important to try to stay ahead of this, and that's why I think that reporting from home by calling 111, some efforts to roll out home-based testing that have started recently in London, and other measures to make sure that someone's first point of contact with the health system can be done in a way that's isolated from others and safe is very important.
Do you think it's inevitable there will be an outbreak here in the UK? So far, the number of confirmed cases relatively low compared to what we're seeing in the rest of the world. Do you think it's inevitable, and what would be your assessment of a reasonable worst-case scenario, which is a phrase that we're hearing a lot at the moment?
I don't have a crystal ball, and no one can really predict the future. I think what we've seen in terms of the dynamics of this epidemic over the last several weeks suggests that while we're seeing a decline in cases in China, we're obviously seeing increases elsewhere. I would imagine that we'll see continued growth of cases outside of China, and that it makes sense to be prepared for a worst-case scenario in which we saw significant cases in the UK, because preparedness is obviously the way to avert that possibility.
OK, Dr. Peter Drobak, global health expert at the University of Oxford. Really good to talk to you this afternoon. Thank you. Well, Sky News is going to have a special programme on the growing COVID-19 outbreak. You can watch it on the channel tonight at 7 o'clock. In other news, at-risk areas in Ironbridge, Shropshire are being immediately evacuated this afternoon after the River Severn breached flood defences in the town. We can take a look at the view now from